This is Dr. Scott Farley. I'm going to talk today, we're going to talk about posterior lumbar surgery. We're going to talk about why you would have a lumbar decompression and a disc removal versus a decompression and a fusion. I'm going to discuss with you, and we've talked about in the past, the placement of pedicle screws or the bone screws for a fusion. And I'm going to kind of walk through also now today what we call an interspinous process device, which is a different type of device that is can be used for fusion and can also be used for patients with spinal stenosis. For a decompression, the idea is we're going to open up the space for the yellow area or the nerves and the nerves entering or exiting out the neural foramen. And so it's simply conceptually the idea of removing bone called the lamina and a portion of the spinous process on both sides or one side to help open the space for the nerve roots. And as we talked about in the past, some patients may have to have too much bone removed. There may be too many changes and too much component of back pain, and the patient may require a fusion. And a fusion, it can be done in a variety of ways. It may be done without any type of implant, meaning pedicle screws or interspinous process device, and just be bone graft that's laid across the transfer or the transverse process and across the remaining lamina. The pedicle screws are another reliable way to help with fusion rate, which is the placement of screws through the bony channel called the pedicle with placement of a rod between them. The reason clinically that a fusion may be used versus the decompression is the patient, their age, and what their symptoms are. So for a patient who has a component of what I call axial or very center back pain as a driving pain source, many times a fusion is required. If a patient only has what we would say is buttock and leg pain or radicular pain, it's very possible that a decompression and an opening of the nerve root called a foraminotomy and removal of a small piece of disc may be beneficial without the fusion. And so that is a long discussion and takes a lot of thought from surgical planning and also discussion with a patient as to which of those procedures is better given the clinical findings, given the findings on their MRI, given their findings on an EMG, and coming up with an appropriate plan for each individual patient. Now, we've talked about a decompression where we're simply removing bone. We've talked about pedicle screws, we're replacing the screws into the pedicle. And there's another option for patients, what we call an interspinous process device. So this is the side view again. And so we talked about those processes that we can touch with our finger, the spinous process. And so in this case, we're using a device that would go between the spinous process and then become attached to the spinous process with basically as a rivet to then make that posterior segment stable while we bone graft around the joints. And so again, interspinous process just again by the anatomy between the spinous process. This can be used as an adjunct to pedicle screws. This can be used as a standalone device. It can be used as a device by itself and then also with fusion of the joints. Now there's another reason for an interspinous process device for patients who have a diagnosis of spinal stenosis or narrowing of the spinal canal and the patient has neurogenic claudication. A patient who were to go to the shopping center and go to the grocery store that leans forward over a cart is able to walk with significantly less symptoms because by leaning forward, it increases the area of the spinal canal just enough that the symptoms and pressure do not mount in the back and their lower legs. For a patient who has this type of problem, instead of doing a decompression and removing significant bone, an interspinous process device can be placed in this area. These are two different examples, two different companies' products. And so the idea is that this is a spacing, a blocker that in effect leaves that segment in flexion, like leaning forward all of the time. So when someone stands, they're unable to extend across the segment. Therefore, the space of the spinal canal remains more open and the symptoms are significantly less. So we have options for bony removal, which is a laminectomy or considered a decompression. We have the ability to decompress and add pedicle screws for a fusion. We can use interspinous processes device for a fusion. We can use an interspinous process device for a patient with stenosis and tightness and not have to remove bone, such as a laminectomy, for neurogenic claudication. And so these are just to give you an idea of the options available to you, which you would need to talk through with myself or your medical provider to find the best option for you.